As for the ugly, this is often the opportunism that I like to talk about that goes on here, and people who are playing culture wars at a time when we should be well and truly above them. I want to point you to the editorial in the Sydney Morning Herald today, the Channel 9 newspapers, where they say that, among other things, we need to have Grim Reaper-style ads from the 1980s. These, of course, were the Grim Reaper ads that scared people about having sex because it may well end up transferring AIDS. They were made at the absolute height of panic about AIDS, and it was something that, well, a lot of people looking back on see it as an excellent ad, but I want to show you an article from The Conversation that was written a few years ago, which said that AIDS, homophobic and moralistic images from the 1980s that still haunt our view of HIV. One of those reasons was the Grim Reaper ad. But the Sydney Morning Herald's editorial reads today, in part, that Australia's greatest weapon in defeating AIDS and the virus of the 1980s was an advertising campaign called The Grim Reaper, which warned people about the need to practice safe sex. It was fearless, it was graphic, and it worked. It was also later viewed as being something that was detrimental to people who had AIDS, and at that time, the homosexual community. Unfortunately, more than a month into the coronavirus epidemic, the government still has not produced anything like it. Now, we're hearing this a bit. People who don't think that the ads are scary enough or the ads are in enough places, including people in the media who are saying it's not in enough places. Well, what's to stop every media organisation running these ads for free? What is to stop these media organisations coming up with their own creative ways of telling the message? Why can't we have people who own outdoor billboards donate those billboards, or at least one cycle of those electronic ones, to tell us the clear message? It's not just about government buying advertising time on television, radio and newspapers. It's also about media passing on real information. That includes the information about just how many people will get it mild versus get it and are currently in intensive care. It's currently 12 people. It's also there to make sure that in the real estate that you have, if you own a radio, television, signal, or you have the ability to put something on the top of your front page, you decide where that real estate is. Charging the federal government to send out a public health message during a time of a pandemic seems to me to be a little bit creepy.